Now we move on to Paul Moulton from Isle of Man Television. Good afternoon, Paul. Faster Mai.
Good afternoon, Chief Minister. And Mr Ashford, do we need to add an R number now to these statistics, by the way?
No, in terms of the R number, Paul, it goes back to a conversation I think we did in one of our one-to-one interviews during the last lockdown. When it comes to small jurisdictions, the R number isn't quite as relevant because where you get very spikes in statistical changes, which changes your R number. So, for instance, if you looked at Jersey and when Guernsey had their cluster and where the R number looked to be, it wasn't really representative. R numbers only really work in large jurisdictions. They don't work so much in small jurisdictions where you may have spikes in numbers. But I'll bring the Director of Public Health in if she's anything further to add on that.
No, that's absolutely correct. Indeed, looking across the UK, even at local authority level, and local authorities are bigger than our population, the R number is not useful. So, yes, I completely agree with what Minister Ashford has just said there.
OK, and just to be confirmed, it was 8 more cases today? Because I was just looking at the website, it's not been updated yet. Is that the case? 8 more new cases today?
On the lab figures, Paul, that I have in front of me, it's 6 that have been reported in the last 24-hour period. Fine.
And my second question is, you say you've given vaccination now to the first over 80s, but I've been talking to care homes, and obviously these are out of town as well, and obviously no sign of that, no sign of the letter which is needed, and of course this is a very important part of the process, and I think there's a bit of concern from some of the nursing homes I've talked to because they've obviously got a full lockdown situation going on, and I know the people who are working at the homes have now had their vaccines, but how long until you actually can see a full run and a full rollout to all the other people of over 80 years old?
Yeah, as I just stated in the statement, we're planning to start the rollout to care home settings later this week, with an expectation that it will be completed by the end of January. In terms of the letters, I assume you're referring to the consent letters. For those that have capacity to do so, that will be done at the time of the vaccination. So in relation to the care home settings, we will be going in with the consent letters for them to sign.
Has that been signed off, though? I heard it hasn't been signed off last. I was getting information. Is that done and dusted, the consent form?
Paul, I didn't hear the first part of that.
Is the consent form finalised and signed off? I heard it was still being worked on.
Yeah, my understanding now is that the clinical protocols will be in place in time for us to start rolling out at the end of this week.